How are you finding working as a frontliner in the Birmingham hospitals?
Well, there have been some big challenges, and we've learned, of course, from our colleagues in Italy and in other countries, and we've scaled up our capacity for care so that we're able to cope. But these patients are different. This illness is unlike anything we've seen before. We're learning all the time, and the mental stresses, the emotional stresses on frontline health professionals, as well as courses on families, are huge.
You very much believe in teamwork. How have you been operating in the hospitals where you work as a frontliner?
Well, it's been astonishing. I mean, the resilience of the NHS staff working in intensive care is one thing. Staff have been brilliant. We've asked staff to extend their shifts, extend their hours. They've been fantastic. But it's about all the other health professionals from all the other disciplines. So, for example, the other day I was helped to put on my personal protective equipment by a nurse who normally works in a sexual health clinic. I was on call overnight with a consultant chest surgeon, a consultant chest physician, nurses from other areas. Everyone's coming together to support the critical care and the emergency care effort.
And you see, there's also the support staff that we don't hear of, the cleaners and the technicians, and those make up part of your team. What about the deaths, the figure of deaths? I mean, it's very high in the United Kingdom. It's almost reaching 30,000 and is now more than Italy. What are your thoughts about that?
Well, no one in the UK is proud of this. We now have the highest death rate in Europe, and we're surpassed only by, America in the Western world. So this is frightening. I think it's partly contributed by the fact that we have a very densely populated country. We have 67 million people living on a small island or in two small islands. So that's one part of it. We have some very large cities with direct travel between them in Birmingham and in London, which collectively, with their broader populations, are over 10 million people. So that's a large number of people in very small spaces. We have a high mix of ethnic groups, and we know that people from ethnic minorities are more likely to be severely ill with COVID-19 than people from other populations. But how much of this was a failure to lock the government down quickly enough, a lack of PPE to frontline health professionals, and a lack of testing to frontline staff?
Do you think that everything is a bit more stable now with regards to the way it's being managed?
Well, certainly. I mean, we are coping as an NHS. We expanded our critical care capacity, and because we had that luxury of time to prepare for this, we have been ready and we have been accommodating people and treating them safely. We now have better supplies of PPE, personal protective equipment, to the frontline staff, both in hospitals and in the community sector, although there are still gaps. Numbers coming into hospitals are reducing, and the case fatalities, the number of deaths every day, are also reducing. But hospitals are still quite full, and we need to see that reduce before we can see lockdown ending safely.
Yes. Do you believe you've reached or passed the first peak?
Yeah, it's interesting that you say the first peak. I genuinely believe we are past the first peak.
Okay, which is great.
Of course, and that's fantastic. And it's good that the NHS has coped. What we don't know is how big the second peak is going to be if and when it comes.
Yes, and but obviously you've got more knowledge now and more means and ways of controlling it to prolong it, I suppose, and flatten that curve.
Absolutely, and it is about flattening the curve, and it's partly around the government's actions and what they're prepared to do to flatten the curve, but it's also partly around the public's behaviour. And it's absolutely vital we reinforce to the public in every country. This is about you sitting at home saving lives. This is about if we behave. It's very difficult. People are running businesses, people want to see their families and their friends, but if we just behave, we can flatten this curve, and our healthcare systems in any country can cope.
Can we speak about vaccines? Because obviously that's the answer, especially to people who are very vulnerable. What are your thoughts about the vaccines?
So we hear encouraging news from companies like Pfizer that suggest that they might have a vaccine before the end of this calendar year. Now, that would be enormously good news. We know that vaccines are not perfect. Vaccines do not absolutely prevent people developing an illness, but they significantly reduce the likelihood. So if we can get a vaccine by the end of the year, then that would be good news. It would allow countries to return to normal more quickly. But if it's going to take more like 12 to 18 months, then we have to be prepared for a series of lockdowns. To relax lockdowns, allow the public to interact to a certain extent, but as cases start to rise again, it's likely governments will have to lock down again.
Yes, so you think there might be a second, more intensive lockdown. Can we touch base on the clinical trials that are happening in the United Kingdom?
So I'm not a clinical researcher,
no.
But to my academic...
But you're very much a frontliner, and I must also say we didn't really speak about your background. Perhaps we can very quickly, because you'll be with us again next week, about more of your speciality. But if we can share with our audience a bit about your background.
Yes, of course, and we can come on to the clinical trials. But as a frontline clinician, I watched people dying from sepsis 10, 15 years ago, and it was unjust. People should not have died. So I set up the charity, the UK Sepsis Trust. I then joined the global movement and now sit on the board of the Global Sepsis Alliance. So we have huge activities in all countries around the world. We have the WHO, the World Health Organization, have adopted a resolution on sepsis. We presented to them a couple of years ago. So countries around the world are acting on sepsis. The learning from sepsis can be applied to COVID-19. They're not the same condition, but similarly, what we learn now in this pandemic is likely to help people in the future when they present with an infection of any cause, because we're learning more about the genetics around this, the way the body responds, than we've ever done before, simply because we have so many patients to look at.
May I ask you, have there been any records of patients with sepsis and COVID-19?
Absolutely. So we know that people who've had sepsis before are more likely, if they've had it very recently, to have an exaggerated reaction to COVID-19. But around 1 in 3 people in intensive care units with COVID-19 are also developing sepsis. So they're developing multi-organ failure, an extra infection on top of COVID-19 with a bacterium, a pneumonia or a water infection, and they're developing sepsis as well.
That's very interesting. I'd like to speak a bit about Birmingham. How has Birmingham compared to the rest of the United Kingdom with regards to COVID-19?
So we saw the first cluster of cases in London, and about 2 weeks after that cluster, and the cities by rail travel are only just over 1 hour apart, and many people in Birmingham work 1 or 2 days in London. So it's unsurprising, but around 2 weeks after the cluster in London, we started to see the cluster in Birmingham. The other cluster we've had has been in the northwest of England, in Manchester and Liverpool. Other parts of the country have been relatively spared, but in Birmingham, very quickly, hospitals became not quite full, but very near capacity with patients with COVID-19. Our intensive care units, every patient had COVID-19. People with other illnesses simply weren't coming to hospital. Because we had expanded capacity, Birmingham hospitals coped, and we've been able to treat people well and treat people safely, thanks partly to capacity, but also because of the brilliant staff of all disciplines that have been helping.
That's great. And what about the public in Birmingham? If we take Birmingham, which is vast, how have they coped with lockdown? And what do you think the general thought is about the expectations post-COVID?
So this is about geography. It is about populations within a certain region and how they're behaving, but it's also about different groups within that particular geography, within that particular region. By and large, the people of Birmingham have been behaving brilliantly. In the very early days, we saw people washing hands. We've seen people wearing masks, and mask behavior, if we are going to wear masks in public, is important, but wearing masks can help to reduce spread. Social distancing, it's normal in Birmingham right now that if we're walking down the street, we're maybe going to the shop to buy essentials, then if someone's coming the other way, we cross to the other side of the road and we say good morning or we say good afternoon, but we're distancing ourselves. So by and large, people are behaving, but I speak to friends who are police officers, and there are certain groups of populations from different countries who might be behaving slightly less well. And it's important that the whole of our populations behave well. We need this messaging to go out to all ethnicities and to all parts of the socioeconomic spectrum.
I thank you very much for your time, Dr. Daniels, and I look forward again to seeing you next week. Thank you very much. Good evening. I was with Dr. Ron Daniels, who's a consultant in intensive care for the NHS in Birmingham. He's also the chief executive of the Sepsis Alliance, both in the United Kingdom and globally, and we'll be meeting him again next week. I thank you for watching. The news in Maltese will air tonight at 7:30. I wish you a good evening. I'm Hogg for Net News.